Hello and welcome to the New Indian Express. With hair loss becoming an increasingly common concern across age groups, the demand for hair transplants in India is witnessing a sharp rise driven by social media influence, growing affordability, and wider accessibility. But alongside this boom comes a pressing need to separate medical necessity from cosmetic impulse and to address concerns around safety, proper diagnosis, and the risk of botched procedures. To understand the science, myths, and realities behind hair loss and the surge in hair transplant procedures, we speak with Dr. Gaurav Garg, who is a dermatologist and hair expert, founder at Dermalife Skin and Hair, and Dr. Satish Bhatia, who is a board certified dermatologist practicing at the Indian Cancer Society in Mumbai. Hello, Doctor.
हेलो तो बहुत अच्छा टॉपिक चुना आपने.
Thank you so much. I'll start by asking you,
Yes, please.
how important is diagnosis? Someone might not even need a hair transplant, but they go for it without even proper diagnosis. So, what would you say on that?
So this is very important thing. A proper diagnosis is the root of every treatment. First, we have to
Right.
diagnose what is the condition and what will be the remedy of that condition. Okay.
Yeah.
For that, we need a proper diagnosis. Dermatologists are the one who are trained for diagnosis of skin problem, hair problem, nail problem, etc. All these things.
Okay.
So we are the doctors who have hair diseases in our curriculum properly.
Okay.
We are the trichologists. We are dermatologists. We are trichologists. That's why we can diagnose what the issue with the person's hair is at present and what will be the remedy, either in the form of medicines, maybe with the help of some therapies like PRP, or if baldness is there, then we can suggest patient to go for hair transplant surgery.
Okay.
So these are the basis of any dermatologist who has taken a proper training from a medical college. He has completed his degree. He knows how in which patient they has to do hair transplant, or hair transplant is not required. That this patient can be managed by medicines only. This we can diagnose very easily. In general,
Okay.
if somebody wants to know whether he has to go for hair transplant or not, just look into the mirror. If your skin is visible, if your scalp skin is visible properly,
Okay.
then there are sufficient gaps in which we can implant new roots.
Okay.
Okay, if somebody has a proper baldness from these two side or crown area, then definitely we can implant here. But if there sufficient gaps are there and he can see the skin, then we can implant here in between.
Okay, okay. So, keeping in mind the sedentary lifestyle people have these
Hmm.
days, why do you like what are the other reasons for hair loss?
Yeah, so it has been increased initially that in early ages, patients are getting more of baldness. Um, because of our sedentary lifestyle, what happens? There are some issues with the metabolic activity in our body, due to
Mm-hmm.
which insulin-like growth factors or other things stimulate hair loss.
Okay.
Okay, it is a very complex thing. It is not easy to explain in few words, but your diet actually uh, your poor diet actually increases your hair loss. That's why we start patients in our medical treatment with some lotions and nutraceuticals. These
Okay.
nutraceuticals are basically a combination of vitamins and minerals
Okay.
which are our body lacking. We give them to the patient, and we have seen that with the help of these nutraceuticals, with these tablets, patients are getting good results and they can retain their hair. So definitely, if patients are having a good diet in form of a balanced diet of protein, carbs, salad, everything, they are avoiding junk, empty calories, then they will have good hair quality.
So, how does one make sure that the practitioner is qualified enough to do the surgery,
So
and where do
yes,
we verify it?
yes. So Delhi High Court 3 4 years back, because of some death in hair after hair transplant surgery, they have notified the government to set rules. So the government has set rules for hair transplant surgery. Only dermatologists and plastic surgeons can do hair transplant in India.
Okay.
This has been circular has been issued.
Okay.
These two branches can do hair transplant surgery. Okay, and definitely if it is a dermatologist should be registered with the local medical counseling. Like in Delhi, we have a Delhi Medical Council. Every state has
Mhm.
its own medical council. The dermatologist or plastic surgeon
State Medical
it will be,
Council, that is.
yes, registered with them. How the patient can verify? So, for dermatologists, we have Indian Association of Dermatology, Venereology, and Leprology,
Okay.
IADVL. So we have a website of iadvl.org, on which website, if you will put a doctor's name, dermatologist name there, so it will give you the detail that this doctor has been registered with the IADVL council, our dermatologist council or not. First,
Okay.
we have to register with our council also.
Yeah.
They can verify our degree there. Same with the plastic surgery. Plastic surgeons also have one association. Uh, this NMC website, previously it was MCI. So MCI website also you can put a doctor's name and his locality or other. If you can put, you can verify the doctor is MD or MS or not. The website can show you. But now it has changed to NMC, National Medical Council. Uh, that I'm not sure because I have not checked that website because it happened after COVID. So,
Okay.
but
Okay.
definitely these websites have all doctors' data available, so one can verify there. And as per a government's rule, two specialties like dermatologist and plastic surgeon can do hair transplant.
Okay. Coming back to botched hair transplants, what are the signs one can tell that this is not done properly?
So first sign is definitely if you are not convinced with your hair transplant, if your friends are noticing that it is looking noticeable, the hairline is not proper, the gap between hair is easily visible, the hair direction is not proper. My means the direction means there is a proper direction of natural hair. It
Okay.
is not like straight hair or haphazard. They are
Mm-hmm.
in a, when you will trim a head, you will see that hair are coming in a direction, and
Okay.
direction is constantly changing. Like here, the direction at the temples direction is different. At crown area, the direction is in whirl pattern. So if the patient's after hair transplant, the direction is not good, the density is not good, the hairline is not looking natural. There are many gaps there. Then the patient needs some correction, and this type of results comes under botched hair transplant. Also,
Okay.
in many patients we have seen the donor area has been compromised so much. They have taken so many grafts from that area that the
Okay.
donor area still is showing some baldness, some bald patches. So
Okay.
that comes under also botched hair transplant.
So, can you take me through the ideal step by step procedure of a hair transplant?
So the procedure is generally done under local anesthesia.
Okay.
Okay. So a local anesthesia means we do not have to make patient completely in sleeping. Not, it is not like general anesthesia. We have to numb only the recipient area, the bald area, and the donor area. So these
Okay.
two areas will become numb. Patient will be
Okay.
totally awake during surgery. Okay. So that is done by local anesthesia. We give injections at certain points that make the whole scalp numb. We deliver some more injections to control the bleeding. Then we start making very fine spaces called as slits into the recipient area. Then we take out grafts from the back of the scalp with technique FUE, follicular unit excision technique, in which we are taking out units one by one and implanting it in the sites that we have created previously. So this way we
Okay.
do complete the surgery.
Okay. And what does body transplant mean? Like, where
So
else
what
can we
happens?
take?
Yeah, what happens that from a normal scalp donor area, we can take around 4,500 to 5,500 grafts from the scalp. If somebody
Okay.
is more bald, like he's in grade 6 or grade 7, that patients require more than 8,000 grafts. So the remaining number of grafts we have to take out from the same person's body. We can take out from the beard, we can take out from the chest also. In
Okay.
FUE technique, because we are not making any cut, we are just taking out grafts with very fine instrument, so we can utilize the body hair very properly. There is another technique which was very popular previously around 15 years before, that was FUT, follicular transaction,
Yeah.
in which we are taking out grafts by cutting the skin. But that technique is not popular right now because we
Yeah,
cannot
it's
take out.
outdated.
Yeah, it's outdated because we cannot take out more than 2,000 grafts. Generally, we need around 3,000 grafts for the front area, 2,500 to
Okay.
3,000 for this area. So with FU technique, we can take out more than 5,000 grafts from the scalp donor area. If patient requires more, we can take out from the beard, we can take out from the chest. These were the limitations with FUT because we cannot make a cut here. We cannot make a cut in the chest. So FU is the very good technique right now, and we
Okay.
can cover very big areas of our patients with this technique.
So, what is the cost and the recurring expenses?
Recurring expenses are very less because these here are much permanent. Cost
Hmm.
depends on surgeon to surgeon. Generally, people charge around 50 rupees per graft, depending on the surgery goes. So, on an average, in daily, if you can say there are around 80,000 is average rate for the frontal hair from this area. If somebody is
Okay.
bald from here to here, around 2 lakh he has to pay. There are
Okay.
some modification in surgeries. There are some few things we have added. Might go surgery cost around 3 lakh also for from here to here. In some patients, there are few techniques more are coming up. Machines are costly for that. Those are more expensive than this. But in general, if you are asking a cost around 80,000 to 1 lakh for the front area for this area.
Okay. Okay. And you were saying that there are no recurring expenses.
Recurring expenses in the form of only applying minoxidil. This is a medicine called as
Okay.
minoxidil to
Okay. So
apply.
you have to apply minoxidil
Yeah, to
after
maintain
getting
the
the transplant
proper blood
also.
flow. Yeah, to maintain the proper blood flow. That's all. Even
Okay.
if you are not applying minoxidil, it is not. It will not happen that hair transplanted hair will not grow. It is just to
Okay.
make your area more vascular so that the grafts will get more of blood supply.
Okay.
That's why we
Okay.
gave it minoxidil. We give multivitamins also after surgery. After some time, we stop multivitamins, but I advise my patients to continue minoxidil after surgery for 1 year, 2 year, 3 year, so that
Okay.
proper supply is there.
Okay. 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 So is it like one person can get the transplant only once and it is not needed again, ever?
Most of the patients do not require transplant on that site again and
Okay.
again. If done
Mm-hmm.
it properly, it stays with you for many years, 10 years, 15 years, 20 years, 25 years. There is
Okay.
no such of data that it will go only for 5 years or 2 years. Okay, it
Okay.
retains with the patients for many years. That happens that patient is developing another area after some time
Mhm.
because it is a gradual progression. So at the age of 30, if patient is bald for the front area, he can have another bald patch at around 38 or 40 years for the neck. So he can go for another area at that time.
Okay.
It is seen that after sometimes around 10 years, 15 years, transplanted hair can become little bit thin with age. That
Okay.
is possible because your donor area might thin after some time. But
Mm-hmm.
they have vanished totally. They are not present. That happens very rare. So in medical science, we never give a guarantee that it will retain with you because it is not a product of any company, not of any
Okay.
factory. It is patient's own hair. How will it behave in future depends on patient's own genes.
Okay.
But we have a data that most of the patients do not have any problem.
Okay. All
That's
right.
why it is popular and patients are retaining hair. Thank you
Thank
very
you.
much.
Hello, Dr. Satish. According to you, what are the causes of a hair transplant failure?
Okay, see, many are there. First of all, it's not entirely the surgeon's fault. Okay, of course, surgical experience is a major factor, but the failure is multifactorial. Number one is poor patient selection by us.
Okay.
Okay, now since everything has become monetized and commercialized, many of us are just taking in patients without even doing the proper blood work. And there's
Yeah.
something called as DUPA or DUPA. Okay,
Okay.
it is called as diffuse unipatterned alopecia, which even though the hair transplants are done wherever we put the FUEs or the FUTs, they keep dropping off after 3 to 4 months. This has
Okay.
happened to us in, I would say, out of 10 on an average, 2 to 3 of them, they are very dissatisfied because
Okay.
they have this condition, which we've recently noticed. It's called a DUPA. in spite of doing all the tests and everything, see the patient seems to be healthy. The hair loss is there and the hair grafts are also falling off. So obviously the patient dissatisfaction is there.
Can it be repaired?
Yeah, it can of course be repaired, but also like I said, because of DUPA, this condition, the graft quality itself is very poor. You know,
Okay.
and the other one is when we take the graft and we keep it out and we keep it out for a longer time. So there is, like dehydration of the graft itself.
Okay. Okay.
Yeah. So hair grafting is nothing like, how you put your plant sapling to another soil. If
Yeah.
you keep it out for too long, the same thing goes for a hair graft itself. So the hair bulb or the stem cells of the hair, they dry out.
How long can we keep it out? Like, what is the procedure?
So it's usually done with, we keep them on a gauze piece, which is sterile, of course, with normal saline, and we keep them hydrated. But even then, it depends on the environment of the clinic itself. If the
Okay.
clinic environment is not maintained well, if it's unhygienic or less sterile, then the chances
Yeah.
of the graft survival or the chances of any infection of the graft is also possible.
Okay. Okay.
And then
Okay.
the patient underlying factors, Supriya. One is if the patient's got some condition like seborrheic dermatitis, or
Right.
he's got an inflamed scalp itself. So on an inflamed scalp, the chances of the graft surviving is very poor.
Okay. Okay. So after the surgery, sir,
Yeah.
how long does it take for the scalp to heal properly?
It takes at least about 3 to 6 weeks.
And what are the other things that you would suggest a person to, take care of after getting the transplant done? Like, what are the precautions post and pre?
Okay. Uh, Pre is like I mentioned, you got to find out all the underlying condition. Post
Yeah.
procedure, the patients are given antibiotics, painkillers. They got to rest it out. You cannot increase your intrathoracic pressure. Basically, some people go out for a workout or they start playing tennis or something, which increases the intrathoracic pressure, which may cause the grafts to pop out. So, no physical exercise for the next 3 to 5 days. Okay. They are given antibiotics
Okay.
and
Okay.
painkillers and we give them specific shampoos. We give them steroid based shampoos so that the hair grafts do not fall down and they do not get inflamed also per se.
Okay.
Yeah.
So, who can get it done, sir? Of course, diagnosis is important, but is there any age bracket?
I would say the younger age bracket is a better bracket. Patients who are not having any underlying skin disorders like seborrheic dermatitis, psoriasis, these conditions, specifically sensitive skin patients, these
Okay.
are poor candidates for hair transplants.
Okay.
Yeah.
Okay. And they also say that you're not supposed to go inside a swimming pool or wear helmets for some time after getting the transplant done.
Absolutely, yeah, yeah.
They
So,
have a separate cap given by the doctors.
what we do is anyway, when we are doing the procedure, we put a band, a tight band to prevent the excess blood flow also coming into the scalp when we are doing the
Okay.
grafting. So that band is taken off after 24 hours itself. So then
Okay.
we advise the patient not to swim because of the salinity of the water or the chemical, the chlorine in the water, which may cause the grafts to get infected or the grafts to fall down, or to wear tight helmets, of course.
Okay. Okay. So, what is the success rate?
You want an honest opinion? So the
Yes.
honest success, we like I said, out of 10 patients, we have 7 to 6 patients who are satisfied.
Okay. Okay.
Because now what is happening is because of the improper planning, so improper graft placement, so they get the hair which looks like more like a plug doll appearance or
Okay.
excessive grafts being put. Now, remember the first thing what I said, it's there should be not monetization. Sadly, it's happening. So excess monetization, basically what I'm meaning is we usually charge per graphs. So
Okay.
so the public is being told use excessive graphs to make it more denser.
Okay. Okay.
Like everything is stepwise. It's not the surgeon's fault. It's not the patient's fault. It's just a mix of factors. The counseling should be done, and everybody is not. Yeah, this is one drive home message, Supriya. Everybody is not a hair graft candidate.
So, what are the side effects?
The side effects are one is the most important is the healing phase. I can tell you one is
Okay.
crusting, erythema, mild edema from day one, the first week itself. The second week is where we kept the grafts, the shedding happens. Okay. It's called the shock loss phase. That is
Okay.
from day 7 to day 14 on the first 2 weeks.
Okay.
Then 1 to 3 months is the dormancy phase. At the end of 3 months, you start seeing new hair growing.
All right. All
Okay.
right.
Now, the other side effects are most important is edema, that is swelling,
Mhm.
which,
Okay.
which can happen to the best of surgeons.
All right.
Folliculitis or
Mhm.
inflammation of the hair follicle wherever we've grafted the hair follicle. And shock loss. What is shock loss? Is when we graft the hair, even though it's your own hair, the body doesn't recognize it for some time and few grafts fall down.
Okay. Mhm.
And scarring, which is commonly seen in FUTs. So wherever we kept the graft, begins to scar around the hair graft. So this is the hair
Okay.
and it begins to scar around that area. Okay.
Okay. Okay.
And most commonly seen is if in inexperienced surgeons, it's an unnatural hairline. It
Okay.
looks like that Barbie doll appearance where we look at them and say, okay, it's not been properly angulated, it's not been properly placed.
Mm-hmm.
Yeah.
Okay. Okay. So, anything else that you would like to tell me?
I would like to say that most important is when you're consulting with your scalp surgeon or your FUT specialist, you need to sit down with them and ask them, A, whether you're a right candidate, is the blood work proper,
Okay.
and what is the success rate.
Okay.
Your surgeon should be able to tell you all these three factors at the time of consultation, and only then and then the patient should go in for a hair grafting because there are other
Okay.
alternatives also available now besides hair.
Mm-hmm. What are all the techniques that are being used these days?
See, hair grafting is the end point or the final one.
Mhm.
But before
Yeah.
hair grafting, we have other procedures like you must have heard of PRP or platelet-rich plasma. Now, what we are doing is something called as stem cells, where we are
Okay.
taking the fat. The fat is being harvested, and we are removing the stem cells, which contain growth factors 1,000 times more than PRP. PRP is from your own blood, but stem cells are from your fat from the trunk area
Yeah. Yeah.
and we harvest that. It goes through a process where we get growth factors which stimulate your hair in a more natural way. Then there are
Okay.
laser light, LLL or laser light therapy lights, which have infrared light, which stimulate your scalp as well. And of course, you have the traditional medicines of minoxidil, oral finasteride,
Yeah.
and oral minoxidil as well. So these are the, I mean, don't jump into, this is my take, don't jump into hair surgical treatments straight away.
How many sessions would one take
It,
ideally?
no, if at all we are doing an FUT or an FUE, it's usually done in one setting.
Okay.
Yeah. One setting is more than enough because we'll be taking at least 3,000 to 5,000 grafts depending on the area to be treated.
Mm-hmm. Okay.
No,
Okay.
I've told many patients they are not candidates, and some of them they go away angry. They're saying, "Why isn't he doing it?" But then they realize that even some of my colleagues they tell them that okay, because you're not a candidate, the hair graft. So when a good doctor knows when to say no,
Yeah.
so we say that okay, your chances of your hair survival are less, and it would be just a waste of your money. So there are
Okay.
other treatments available, other modalities available, and we should offer them that to our patients.
Thanks. Thank
You're
you so much.
welcome.
As hair transplants continue to grow in popularity, the experts stress that informed decisions, proper diagnosis, and choosing qualified professionals remain key to safe and effective outcomes. Thank you.